The first and probably most important exercise we will go over in our low back pain rehab program is called a pelvic tilt. This is so important because it provides body awareness and pelvic positioning, which is key to perform most other exercises and movements throughout the body. For this exercise, you'll start laying on your back with your knees bent to about 90 degrees. You can use one hand to feel the amount of space between your low back and the table or floor. We're trying to close that gap and decrease that space while activating a deep abdominal muscle called the transverse abdominis. This muscle can be quite difficult to contract on purpose, but is oftentimes contracted when you're laughing. You can feel this muscle by finding the bony parts at the front of your hips and then feeling about an inch inward from each of those bones. That's where you should feel the muscle tension when you perform a pelvic tilt correctly. This exercise is not meant to fire the more superficial abdominal muscles, so you should try not to feel for muscle contraction on the top of your belly. You can also use your hand to feel if you're compressing the gap between your low back arch and the table. Try to feel as well if you are firing your glutes and or your hamstrings, as often those muscles activate to compensate for a lack of pelvic and abdominal muscle control. You should be able to notice my pelvis rotating to become more flat and less dumped forward. You can feel this motion on yourself when you perform it by keeping your fingers on those bony protrusions at the front of your hips. Once you have the hang of the pelvic tilt, perform a pelvic tilt and maintain that position while you attempt to belly breathe. This will allow your body to train itself to be able to breathe while contracting your abdominal muscles. The next exercise we will go over is called a hip bridge. For this exercise, you will start by laying on your back with your knees bent to about 90 degrees. Your feet should not be touching. You will need to start by performing a pelvic tilt, as you will need to maintain a pelvic tilt position throughout the motion. Once you have performed your pelvic tilt, you can drive your weight into your heels so you can lift your hips up towards the ceiling. Be sure that you do not lift your hips up so high that you cause your back to arch, as that will cause you to lose your pelvic tilt and could cause pain. If you're having pain during this motion, try lifting your hips just to the point before pain and then return back to your start position. When you finish your rep, unrock your pelvic tilt and then reset the pelvic tilt position prior to beginning your next rep. Do this after each rep. This next exercise is called a dead bug. For this position, you will again start laying on your back with your knees bent. Perform a pelvic tilt, and once you have your pelvic tilt controlled and maintained, you can lift your feet off the floor so that your hips and knees are at a 90-degree position at each joint. Then you can lift your arms up so that your shoulders are also at a 90-degree position. Make sure you're maintaining your pelvic tilt throughout. Then you can alternate which arm and leg you extend and bring back to the start position. Again, make sure you're able to maintain your pelvic tilt throughout this entire motion. If you feel you're losing your pelvic tilt, set your feet back down and reset the tilt prior to beginning the exercise again. For the cat-cow exercise, you'll want to start on your hands and knees with your knees directly under your hips and your hands directly under your shoulders. You can either tuck your toes under your feet or have the tops of your feet flat on the surface you are on. You will want to then arch your back up towards the ceiling as you drop your head down as low as you can. You want to arch your back by doing a pelvic tilt and tucking your pelvis as far underneath you as you can, while also pushing through your mid-back to separate your shoulder blades as much as possible. You can focus on your breathing as you do this exercise by choosing to either breathe in as you arch up or breathe out as you arch up. See what is more comfortable for you. Once you are arched up, you will then want to arch your entire back down as far as you can tolerate. Don't push yourself into pain. As you arch your back down, you will lift your head up. The bird dog exercise is very similar to the dead bug exercise. However, you will start on your hands and knees rather than on your back. You will again want to perform a pelvic tilt so that you can help keep your back in a more neutral and straight-lined position. Once you have your balance, you will want to alternate your arm and leg that you extend and bring your knee to your elbow underneath you to complete your rep. You can either perform this exercise alternating from one side to the other or continuing to perform reps on one side until you have reached fatigue or your desired volume of reps. Make sure that you're maintaining your balance throughout. It's okay to take a second to rebalance yourself if you feel off balance. Now we'll go into some stretching exercises you can perform for your low back. This first one focuses on rotation, and you'll want to start by laying on the floor with your arms straight out to either side and legs straight down in front of you. Then you can pick up one leg and swing it over the opposite leg so that you will rotate at the spine. Try to keep your shoulders as flat on the floor as you can and keep your head looking straight up towards the ceiling. You can do this exercise on both sides and compare to see if you notice any more tightness on one side versus the other. Since this is a stretch, you should attempt to hold this position for approximately 30 seconds to 2 minutes each time you perform the stretch. Even if you only feel tight on one side, you should still perform the stretch on both sides to make sure that you are not neglecting one side. This last stretch is intended to stretch a deep muscle in your back called the Quadratus lumborum. For this exercise, you will start in a seated position with each leg out to create about a 90-degree angle at your hips. This is similar to the start position of a seated hamstring stretch. If you cannot get into this position comfortably, you should work on continuing to improve your ability to do a pelvic tilt and also address any additional hamstring tightness you may feel. Instead of reaching straight for your toes, you'll want to tuck your near shoulder forward and bring your opposite arm over your head, similar to how a ballerina would. Again, make sure to perform the stretch on both sides for comparison and also to provide equal attention to both sides.